You're listening to Simple Health Radio, the podcast about recognizing medical emergencies and promoting wellness. Your host is Dr. Emron, an experienced ER physician who has treated thousands of people just like you. Information on the show is not a substitute for professional medical advice. Always talk to your doctor or go to the nearest emergency room with any questions you may have.
Thank you so much for joining me today on Simple Health Radio. I'm your host, Dr. Emron. On today's episode, I have a very special guest. His name is Frankie. Frankie is one of our nurses. He and I have worked together for many years in a local emergency department. So I want to thank Frankie for joining me today.
Thanks, Dr. Emron. Thanks for having me.
Absolutely. So in the emergency room, we see a lot of very sick people, and I wanted to talk about a topic that's gained a lot of attention on the news lately, and that's called sepsis. So Frankie, can you tell us a little bit about what a presentation or a common patient would have if they come in with sepsis?
Usually it can be weakness, dizziness. As far as vital signs go, high heart rate, low blood pressure. And then when it goes down to the labs, you're looking more at the high white blood count.
Absolutely. And we had a case of that about a week ago. It was a 35-year-old male. He came in very sick, just like you mentioned. He was very dizzy. He had a hard time breathing. He looked very feverish, very ill, and he was actually a little bit confused as well. And so we did the basic testing. Can you tell us a little bit about what our thought process is when a patient comes in that situation?
When they come in that situation, you kind of want to start ruling out some things fairly quickly with altered, especially being that young. You want to check the heart, make sure it's not any kind of MI. Make sure that, in far as his history, any kind of head trauma that would cause the altered mental, especially being that young. And then after that, your vitals. Is his blood pressure high or low? Right. And if he has a fever?
Sure, absolutely. And I think in his case, he didn't have any injury, but he looked almost like he had the flu. He had a very high temperature. Mm-hmm. It was about 103. His heart rate was very high. I think it was about 120. And you're right, we did an EKG, which was otherwise normal, except for that very fast heart rate. And then what are the next steps? So as a nurse, as a doctor, what are the things we have to do in the first 10 or 15 minutes?
Usually as a team, you hit it pretty fast. So with the high heart rate and the fever, you want to control the fever. So this guy still had his jacket on. We made him put on a gown. That way some of the heat kind of will go off. And then we start medication. Go ahead and do a line. You're going to get labs. And then he hadn't been drinking much. So we know he's a little dehydrated. So we start fluids.
Absolutely. And with sepsis, a lot of the guidelines now tell us that we have to resuscitate. And resuscitate means giving as much fluid as possible. And it's based on the weight. So I think in his case, we had to give almost 3 liters of fluid, which I think is impossible to drink. I don't think a person can drink 3 liters in a day. But in his case, we had to give him that much just to bring his heart rate down a little bit. And then once we started doing some testing, what are the common diagnostic tests that we do besides the blood work?
The lactic acid is the one that triggers everything for the sepsis and your white blood count. So if he has a high white blood count, the lactic acid, like I think his was like 3.3, you already know we need to put him in our sepsis protocol. And we actually have a guideline that tells us what to do, start the antibiotics. But before that, you'll draw cultures because you have to draw the cultures before you start any kind of antibiotic therapy.
Correct. And blood cultures, we do 2 sets. So usually on one left arm, one right arm, and we draw 2 bottles on each side. And the reason we do the blood cultures is to see if any bacteria grow out in those samples, because an infection in the blood, people used to call it blood poisoning. That's really what sepsis is, because the infection, no matter where it starts, it's spreading, and that's causing all kinds of other issues. So you're right, we have to do the blood cultures along with the lactic acid. The lactic acid is a byproduct, so it's actually from the muscles and other organs in the body. So it will increase as there's more damage. And as you said, it was a very high value. So already we knew that he had sepsis. And then you mentioned the antibiotics. So the new guidelines tell us that we should just give antibiotics immediately. So we don't even wait for the confirmation, which is kind of a change, I guess. Mm-hmm. But you're right. We have to hit them very hard, sometimes with 2 different antibiotics initially to cover for the common infections. So what are the common infections that you would anticipate that would be causing sepsis in a patient like this?
You look at their history. If they're diabetic, they're more prone. If he had any kind of kidney issue, he's more like urosepsis. And then there's the bacteremia, where he was probably sick for a couple of days even before he came in.
Correct.
So
it kind of dragged out. And I think people underestimate sepsis in the first maybe day or 2. They kind of play it off. They might use some over-the-counter medicines. And that's a good point. Anyone can get sepsis. So it doesn't have to be the person who's diabetic or a person who lives in a nursing home. We are actually seeing a lot of teenagers and very otherwise healthy young individuals coming in because they've underestimated the infection and it continues to progress very, very rapidly. Now, in his case, we did a chest x-ray. I think we also did a CAT scan. And I think he actually had some type of an intestinal infection. So he may have had something like an appendix infection or an intestinal problem. We don't do surgery in the ER, so he was going to be admitted anyways. Was he improving at all after the fluids?
Usually,
Yeah.
Once the fluids actually help with the temp, and I believe we gave him some Tylenol too. Fever broke. And once his fever broke, he started feeling a little better. Heart rate started coming down because of the fluid resuscitation.
Sure, definitely.
And then we redrew a lactic acid 2 hours later after, and it started showing improvement.
Okay, good. So the labs were trending back down to normal, even though he was still very, very sick. And then I believe we admitted him to the ICU, to the intensive care unit. People like this, unfortunately, they have a high risk of relapsing. Mm-hmm. So oftentimes they look a little better initially with the fluids, and some people want to go home, but we always tell them we have to admit just for observation. And I was reading recently some of the studies, about 50% of people die from sepsis, even those who receive treatment. Tell us a little bit about that. What are some of the complications that can occur with sepsis that leads to death in so many people?
Well, the problem is you can start going into other failures. You can go into kidney failure, heart failure, respiratory failure, because you got to have your heart and your lungs. And if you're already sick and you have other underlying things, it's easy to take out. And it's easier to get sick than it is to get better. And it takes time. Very
true. No, I agree with that 100%. And what you described is the multi-organ system failure. So things sort of shut down, just like a computer or a car. If things get overheated, despite your best efforts, you've done all the right tests, you've given all the right medications, about half the people won't make it out of the hospital. Yeah. And so sepsis, unfortunately, is a major problem and is going to be a major problem in the future because people have other health issues. Many people are diabetic, they have high blood pressure, they have other health issues that they don't take care of on a proper management level. And so we're going to see an increase in this. And recently, many people who are famous, like celebrities and so on, probably have died from sepsis, even though they explain it as something else. I think a lot of those people actually had some issues and may have died from sepsis as well. Very true. And then what are some other thoughts? What are ways to prevent sepsis? What are things that our listeners or family members or people in the community can do to prevent from getting that sick in the first place?
I think once you start getting sick, don't wait it out. Go see your provider. Go see your doctor. Get it taken care of quickly versus just let it lag and lag and lag. Because once it builds up to a certain point, then your body's already been fighting it. Well, now you're almost to a tilting point to where your body is failing. Then we have to try to jump in to help, but sometimes it's too late.
Absolutely. No, I agree with you. I think early intervention is the priority. And I'm glad you mentioned that. People should talk to somebody, either their family doctor, urgent care, ER, get tested for whatever the concern could be. It could be the flu, it could be strep, it could be some other infection. But waiting it out in this situation is not beneficial. I think it would lead to a very serious outcome and death in many cases. Do you have some final thoughts? Any positive words of encouragement or some ideas that our listeners would benefit from as well?
I think if you just, take your vitamins, take care of yourself, exercise, and the better shape you make your body in, the better it'll fight for you.
Absolutely. Yeah, no, I think that's a very good bumper sticker. I'll have that printed up so I can hand out to my patients next time I see them in the ER. So you've been listening to Simple Health Radio. Thank you so much for Frankie for joining us today. He's a very experienced ER nurse, and we talked about sepsis on today's episode. All of this information will be put into a blog. You can visit our website, simplehealthradio.com, and you can also send us questions via social media, such as Twitter, Instagram, and Facebook. And again, I want to thank Frankie for joining me today.
No, thank you for having me.
Very good. And to my listeners, if you have any concerns, please be in touch, and I look forward to having you back on a future episode.
We hope you enjoyed this week's episode. Visit simplehealthradio.com to read the blog, follow links mentioned on this episode, and easily share content with your family and friends. Subscribe to the show on iTunes, Spotify, YouTube, Spreaker, iHeartRadio, and the 3 and Out Radio Network. Be sure to connect with Dr. Emron on Twitter, Facebook, Instagram, Pinterest, and Tumblr to send us your questions and ideas.